The station that's on your side. This is Channel 7 News Daybreak.
Okay, welcome back. 6:23 is our time now. And if you're taking vitamins and mineral supplements, maybe you do every morning as you wake up and watch us, if they're used to help prevent heart disease and stroke, you want to listen up to this, because joining us this morning with new findings from an interesting study is Baptist Health cardiologist Dr. Scott Davis. Back for a second straight week. Let's go straight to it, Dr. Davis. I know. Thanks for filling in this week. I know it's the summertime. Vacations are happening. So let's talk about this new study. What were some of the interesting findings that you discovered and that your colleagues are now using?
The U.S. Preventive Services Task Force, that's a mouthful, always looks at, certain things in our world on the daily that may or may not benefit us. You may remember back in 2014, they released a review of just multivitamins. And understand this is looking at all comers taking, a multivitamin, not if your doctor is prescribing them. It's just taking an over-the-counter multivitamin. And it is basically the same message from 2014. There's been 52 new studies between, now and then, but the basic message is still the same. If you're taking a vitamin to prevent, cancer risk or cardiovascular risk, there's really just no benefit, right? There's a couple that are actually potentially harmful, right? So vitamin E and then beta carotene have surfaced as being, you want to avoid those for sure. But there's always a challenge at proving, that it doesn't work or does work. But based on a large review, meta-analysis review of these newer studies, a publication in JAMA that just came out earlier this month basically said, look, there's no benefit. Here's the thing. We talk about this often on this segment about, just doing basic lifestyle changes, eating healthy, fruits and vegetables, getting off the couch. That still sounds simple, but it yet is still the bedrock recommendation for a healthier lifestyle. I get it. We want to take a pill and make it and keep things simple. But the thing is that the benefits, the phytochemicals of a plant-based diet that you get that are beneficial, those vitamins that you might get from a healthy diet of fruits and vegetables, that can't be packaged in a pill, right? And so now look, understand, if you have low vitamin D and your doctor's recommending you take a supplement, that's not what this is about.
It's supplementation.
Correct. And I get the question all the time, hey doc, if I take this or if I take this vitamin or this supplement or this mineral, is it going to help? And the answer is probably not. And so, there's probably not a downside to it, but there's just not an upside to it. And so just want to make sure that, folks understand, we do get into this, and I'm as guilty as the next person of, I can just take this pill and it'll all get better, right? But it's probably more placebo than it is anything else.
Okay, well, Dr. Davis, as always, thank you so much for coming and explaining the new findings, new studies to make sure that you and your family can keep on amazing and stay healthy. You can do so by contacting the great folks at Baptist Health. Their information is on your screen. For more resources, go to baptist-health.com.